Well, hi friends. It has been a long time since I've done a video. A couple reasons. One is my son got sick and I did go for an impromptu visit to California to see him. And he's fine now, but that was a chunk of time and that was the priority, of course, but I'm back. And so let's do a video today. I'll talk a little bit about what it's like to be a home health aide. I'm a nurse, but my work is not registered nurse home health type of work. I don't do trachs, vents at home, yes to G-tubes and simpler things like that. Mostly activities of daily living or ADLs for these patients. So I have two patients today and I'm heading out this morning to the first one. And in between that, I have physical therapy. So let's go and have a good day together. Okay, so I just finished with my physical therapy and my morning home care patient. Wow, this is a completely different kind of, I shouldn't call it PT, it's a chiropractor. Not a cracking, popping, neck pulling type, not that kind. This is more like a different type of pain rehab person. I've never been to this type of therapy before. It's called Airrosti, A-I-R-R-O-S-T-I. We fix pain fast, rapid recovery, patient focused. So this is only my second session. You have to be pretty dedicated. You have to do the home exercises. Here's the difference. After doing 2 years of PT in a couple different ways, from sports PT to other strengthening, that sort of thing. The difference here is this is the first 30 minutes is hands-on from the DC, the chiropractic doctor. Hands-on, painful, fascia release, point pressure, that kind of thing. And when I say painful, it's needed. And at this point, after 2 hip surgeries and my last one a couple of years ago being a hip replacement, I have got to have something different. I'm back to injections again, front and back. Like, this is just ridiculous. So my orthopedic, what is he called? Physiatrist. He recommended Airrosti and said they're based out of Texas, I guess. There are a couple of them, a few of them here in my state. They're not everywhere, and their approach is very, very different, and it's pain rehab type of approach. Okay, so anyway, I'll discuss more about that later, but I want to share that with you in case you're in a position similar to mine, where you've been to PT and you've done all kinds of things, and you've done strengthening, and you've done the kettlebells, and you've done the what is it called? What's the word for it? Where you have to wear the tourniquet around your joint and do your physical therapy with that on. It's called, okay, I'll put it up. Oh my gosh, why? Why can't I remember the exact name? Flow restriction therapy or something like that. I'll put it up. I've done all that. Time to move on to something different, and let's hope that this works. It is now 3:30 p.m. Okay, I just pulled up. I was thinking I want to mention one other thing about this type of rehab PT stuff, and that is that the beginning of it, if I didn't already say, the first part from the provider, pressure point, I don't know how to describe it, fascia release, pain, discomfort, but needs to be done to break that up and get better oxygen and supplies and so forth. So anyway, to that area. So that's my whole right hip and femur and hamstring. And then when that's done, then you move to the next part of the room and you do 30 minutes of floor time or balance time. In my case, it's both, using the rollers, the foam rollers. So at home now, I have a foam roller that's very, very firm and the other's medium, and I use those also at home at this point to try to really get going on this and see if this will help me. Just like I said, a whole different technique. I'm really interested to see if this will work. And now I've arrived with some strawberry lemonade for my next patient, my mother. Oh, there she is standing at the door. I'm walking up. My hands are full, very full as usual. Well, hey there. What? Oh, this is my video thing. You know how sometimes I do the video? hello. Hands are full.
Well, I'm sure they are. Well,
You can just get the door.
Yes, I think that would be best.
Got drinks, your favorite strawberry lemonade. Got laundry. Oh, I can get in now. Okay. Normally I use the laundry service, but something has occurred. Let me just say that. So I had to bring it home. Strawberry lemonade. Hi.
Are you talking to me?
I'm talking to you. Hi, Mumsy.
Hi, Lisa. I have a bad knee. I'm sorry.
It's okay. We're going to take care of that.
How are you going to take care of it?
Give you your medicine.
Oh, that's all right. I didn't want you to take my leg off or anything like that.
Okay, what did you just ask, Mom?
I said, what is wrong with me other than being old?
Well, nothing. Watering. I planted all those for her. They're doing really well. Some pretty rocks.
Why are my knees so sore?
You have no more cartilage. I'm sorry. We tried. You didn't want surgery, and that's okay.
Oh, yeah. I remember that now.
We've tried the injections. I guess we could get another
Did they work?
for a short period of time, but you've had so many over the years. You know, there is a limit to how many knee injections or joint injections you can get.
Yeah. I'm looking at that bracelet. Have I seen that bracelet before?
You have. So what's really fun about this bracelet is it's called Till Death. Sounds terrible, I know. It just means it's a forever bracelet. I got it put on and then it got welded together, and that was the end of that. And then if you ever need an MRI or surgery, well then, it's really a problem.
What is it called again?
Well, it's a forever bracelet. That's just what it means. And it just represents the moon, and the star represent Josh and Nathan.
Oh.
Yeah. This. Okay, so I just got done with my mom. And to catch those of you who are new, I'm my mom's caregiver by the state. In our state, things might be different than your state or other people's state. I'm my mom's caregiver, medical power of attorney, and so forth. And I've made many videos about this, about being a caregiver for someone with dementia and someone who chooses to stay at home, where you cannot pick them up, put them in your car, strap them in, drop them off. Okay, people do that to the ER though a lot. Oh, and for those of you who are new, I'm an RN. So I do know some laws, and in our state, I had to go to an elder care attorney, I guess it was last summer, with my sisters and I, to really get square with what the fucking law is. So as I'm coming out of my mom's apartment, I run into one of the ladies. Now, I know all of the ladies who live here, and one gentleman. All of them. I've known them for years. I think my mom's been here 15 years, or maybe 14 years. Some of them have been here 5 or 6 years. My mom's been here the longest. Yes, my mom has dementia. I could tell something was wrong, so I said to her, hey, how you doing? How is so-and-so? Is she out of the hospital? Different person who lives there. And then I could tell something was wrong, so I said, is something wrong? Well, it's your mom. Oh, what's going on? She repeats herself constantly, and she needs hearing aids. Oh, yeah, the hearing aid thing. And I kind of chuckle about that, but she was not in a laughing mood. We've tried. My sister Carrie mostly and I have done all that we can for hearing aids. She does not want to wear them. Okay, she's choosing not to wear them. Well, she needs to. She repeats herself. You know that she walks around out here. Does she walk away? No, she just sits on that bench. Well, I know she's been sitting on that bench for years. Okay, what's really going on here? Your mom needs to go live in a memory care facility. She's so bad. Yes, I know she repeats herself. Did something happen? Yeah, I told her she needed hearing aids because she couldn't hear me when we were sitting outside talking. So she got mad at me and she walked off. Okay, well, believe me, she's forgotten about that. You need to do something about your mom. Yes, I've told you that we've been to an attorney, that she's got a neuropsychiatrist up in Seattle at the Brain Wellness Health Center. She has her internal medicine doctor who's known her for years. She goes to the doctor every 3 months. I take her. The care comes to the patient if the patient refuses to leave. Because they have memory problems, they don't use hearing aids. They smoke pot. She doesn't. They sit and lay on their couch all day. Whatever it is, they don't shower anymore. You cannot put them in a facility. I encourage people to talk to the attorneys in their county and in their state, because it is going to be different in each state. Getting a guardian is different than it used to be. The person who has medical power of attorney doesn't need to then also get a guardianship. If a patient or if somebody is verbal and says, I don't want this surgery, I don't want chemo, I don't want hearing aids, I want to live in my own place, I don't want to move into a memory care facility, well then, no, like my other video, it's not okay to trick them, lie to them, put them in your car and drop them off, because they're not going to walk in on their own, and it's a liability for the facility. And yes, there are many family members and facility people who do drop patients off who are dangerous, and who have a history of, say, sexual assault. That's an example I know about. And that person lived at a facility, and then there was an issue. So the patient was dropped off in the ER. There's no family. And then the patient went up to a particular floor in the hospital where the social workers are working round the clock, above and beyond, to try to find a place for some people. And sometimes they can't find a place. And if there's no family, or no family who cares or wants them, well, then the situation is that they're going to live there on that floor. I don't know what else to say, and I don't know what else to say anymore sometimes to people that have no patience, no tolerance, and have such a dislike for anybody with any kind of medical problem, any disability. It's just really sad. I'm here almost every single day. And now it just kind of hurts my heart that when she sits outside to talk with the other ladies, we've got them not liking her now. Such anger. She had such anger for the whole thing. You need to do something about it. Oh, my sister Carrie just texted me, and I was just going to call her, because that's what we do. Like in all my other videos, we call her sister or sisters. Okay, I'm done being a home care nurse for the day. Well, hey, I'm still in the car. I just got home, but listen, I talked to my sister on the way home. She helped me get my head on straight. I'm not angry about it. I don't get angry. I'm not an angry person. It just made me sad more than anything. I think that I would equate it to something like if you send your child with disabilities to school, or you send your child off who has something wrong, and you're hoping people will be nice to her. People will be good to him and include him. And it can happen with geriatric people too. As they change and their disease process is not so favorable and fun to be around, it can affect other people. So that's kind of what I'm facing. We're just going to let this run its course. I know what the law is. I know what I'm able to do, and I reapproach it over and over again. And I just hope that whatever's left of my mother's life is happy, is, where she feels included. Okay, I'm rambling. I'm home. Let's go figure out what to have for dinner. Bye.